Hi, Dudu.
Okay, this meeting is being recorded.
Yes, this meeting is being recorded so that you can give a message to a nurse. Dudu, the question is this: what if you were you're gonna you are a nurse, but if I'm sure Sean, I'm a nurse, and you can see that I'm struggling today because I know you can see if somebody is struggling today. What message would you give me to encourage me today?
You know what? Being a nurse is not easy. It
Mm,
needs a lot of dedication. It needs a lot of passion and compassion. So, what I normally tell the nurses I'm working with is that you are the one who brings hope. You are the one who brings light when there is no light. There are times where ourselves as nurses, we become so disillusioned by the situation that we find ourselves in. But as a nurse, you made a pledge to serve. We are servants. So as a servant, you take a breather, but you have to go forward because the patients are waiting for you. The community at large is waiting for the nurses. So I'm saying that when you feel that you are exhausted, look deeper into yourself. Try to get into those reserves to say, by the way, I'm here to serve. And if I get tired, if I get, reaching a stage where I feel that really it is exhausting, there's still a lot to be done. We've done a lot. Don't forget that the community, the society appreciates everything that you do. You are a beacon of light. You are a beacon of hope to those that are about to lose hope. So as a nurse, I know it's tiring. And when I look back, reflect on the past 18 months that we've been through the pandemic, a lot of us are exhausted by now. But there's still a very long way to go. There's still a long way to go, and we cannot give up now. We cannot stop now. We have to keep on fighting the virus. And everybody knows that without nurses, the economies, they collapse. The governments, they find themselves battling to deal with the pandemic, but their hopes, they are looking at us as nurses. They are saying, where are the nurses? And nurses are just there. So
mm.
I'm saying, don't ever get tired. And you are highly appreciated. You were born for this. Go for it. Do it. Nursing is a lifestyle. You can never divorce yourself from the profession. That's why I normally say to all the nurses that are in the front line, they have to know that they are carrying the banner of the profession. They are the ones giving hope. They are the ones who are in the forefront of the war, and you cannot turn back right now. There is still a lot. Even after the war, we're still expecting new nurses to be there. Because with COVID, it's something that is really new, and everybody is adapting to it. There is nobody who can say, I'm very experienced in managing this. That's where then the knowledge and the skills that we acquired over the years, they come handy now. Where you find yourself that, you know what, it seems like it's difficult for me to go forward, but look deep into yourself and say, by the way, I am a servant and I will do this. That's how I serve. That's how I give back to the humanity, because it's not only about those that are in hospital. No, those that are in hospital, we're at a curative stage. The community health workers, the nurses that are there in the community, they are the first people to identify that this patient is going through this. Let me refer the patient. They are doing a lot as well. They are the ones who are doing the triage that we expect, to be done by the nurses. But a patient comes to the hospital, the nurse, primary healthcare nurse, has done everything. That's why I'm saying nursing, it's broad. Nurses are in our community. Nurses are in our society. I'm calling all the nurses to be the ambassadors of our profession. Say, I will only be a nurse once I enter the hospital. No, you are a nurse. Even when you walk on the street, you are a nurse. And you are there. You are there to continue educating the community, to continue educating the society, to continue bringing hope. Because it's not only about being in hospital. Nursing is about using self to heal others. what we call is therapeutic use of self. You are using yourself to heal the people around you, the community that you live in. Even when you go to the church or the places of praise, you are there. You are not going to distance yourself to say, I'm no longer at work. You will be forever in this. It's a lifestyle. And we really, really, really appreciate whatever that you are doing as nurses. And this is just the beginning. We don't know the after effects of the COVID-19. So there are so many things that as nurses, we have to go back and say, okay, then we're in this situation. How did Florence Nightingale manage to navigate this? But she is the founder of our profession. And I normally look at the current situation of the COVID-19 pandemic and say, we are doing exactly what Florence Nightingale was doing during those years. She was faced with the same situation, but she never tired. She never gave up. She said, I'm going to use myself to heal others. I'm going to be there for them. And at times it's not about, giving medication, but by being there. At times patients, they don't want anything from you. They want you to be there for them. Being there. Listen. And being there, it means you are even there to try and identify even the unsaid messages from this patient. Their fears, you cannot see them, but you can feel them if you go with an open heart. Nursing, it's very, and when I talk about my profession, I normally say, some of us, they were born for this. They were born for this. You can't run away from nursing. You can retire in terms of being an employee, but you'll never retire from the profession, because nursing is more than just a profession. It's a lifestyle.
Thank you, Dudu.
So the nurses out there, they have to know that this time it's about them giving all their best, doing the best that you can. And right now, I'm seeing a situation where we're looking at the physical part of it in terms of managing the COVID-19. It's far beyond the physical part of it. There is a social part involved, because the societies are really battling to deal with COVID. So even our societies, they're expecting us to be the voice of the voiceless, to be there, to give hope within our communities, and to be the ambassadors of our profession. And then we're seeing a lot of mental health. Right now, a lot of our nurses are going through a lot of mental health problems. They are depressed. They feel anxious because they've got families as well that are also exposed to the virus. But they have to care for other people. So it's more than worrying about the physical component. Let us bring everything that we can bring to assist and heal our communities and the society at large. Nursing is more about giving yourself. You give yourself selflessly. You go there and say, by the way, if I die doing my profession, it means I've fulfilled my purpose in life, because I'm a nurse.
Amen.
Yeah.
Amen. So I forgot to ask you where you stationed, and which where. Well, I'm asking it right. Where you stationed? It sounds like you're really in war. But okay, Dudu. Thanks. We'll speak again.
Okay, then. Thank you very much.
Okay, thanks, Dudu.
I really appreciate it.
Me too.
I really appreciate it.
Thanks.